Start out by saying that when you're multidimensional, you have to live with the fact that you know nothing about everything. So you're no longer an expert in anything. So I'd like to talk today a little bit about something that we've just begun to look at, and that is the relationship of social adversity and pesticide exposure. But before I get there, which are just at the very, very end, I'm going to give you a little bit of a background on the other things that we're working on right now with regards to neurodevelopment. Okay. So many of you have heard about CHAMACOS, many of you have heard about Salinas, but I'm just going to give a few slides to review it all. So we do our research in the Salinas Valley. It is the salad bowl of the nation. For us, it's very fortunate that we're doing the research there because they farm about 11 months a year. So when you're looking at a mobile farm worker population, they're going to be less mobile if you're studying a population that farms for 11 months a year. So our study, the Center for Health Assessment of Mothers and Children of Salinas, or CHAMACOS, which means kids in Mexican Spanish, is a longitudinal birth cohort study investigating mostly pesticides, but also many other environmental exposures and how they affect growth, neurodevelopment, and respiratory disease. And the respiratory disease part I do with John. So in 1999-2000, we enrolled around 600 women, and we enrolled them from clinics that were serving farm worker families. So the women themselves weren't necessarily farm workers. Only about a half of them were farm workers, but almost all of them lived with farm workers. So they're farm worker families. Most of the women were Spanish-speaking. They were living within 200% of poverty. So when I looked at, I forgot someone's slide about poverty, and I said, everyone in our group is below that level. It's a very economically disadvantaged population. About half the women had lived in Mexico before 5 years before they entered the study. So that meant we didn't ask, but we believe because of amnesty laws that about half of them were likely to be illegally or undocumented in the United States, which added an extra difficulty into doing the study. But one thing about it at the time, and this is before the ACA, Obamacare, is that during pregnancy in 1999-2000 was probably the only time you would get insight into farm worker health, especially for an undocumented population, because you could get prenatal care even if you were undocumented. So we could get to see the insides of homes and the farming conditions and the living conditions that many people could not get access to. So it's a longitudinal birth cohort study, which means we enrolled the women during pregnancy. We have now followed the children at birth, where we did neurodevelopmental testing at birth, at 6 months, 1 year, 2 years, 3.5 years, 5 years, 7 years, 9 years, and then we started pubertal assessment, so we needed to bring the kids in every 9 months after that point. And we've also done detailed neurodevelopmental assessment at 9 and 10.5 and 12, and we've just almost finished the 14-year-old's assessment, and the first child turned 16 in February. So we're up to the 16 year, and we're still funded for 16. So we have looked at we have measured about 100 different chemicals in different matrices, whether it's in milk, breast milk, or urine, or blood, or house dust, or kind of you name it, we've measured it in teeth. And because of it, and not every, I love it when you go to a meeting and someone says, just give me a drop of blood and I'll measure whatever I can measure. And I'm thinking to myself, no, you won't have the sensitivity to measure blank, blank, blank. It doesn't work like that, at least not right yet, soon maybe. But we have collected lots of different biological samples, about 150,000 biological and environmental samples that have been stored in a large biorepository in Richmond, but don't share that with anybody who could bomb Richmond at this point because it's very valuable. Lots of freezers. We've looked at, as I said, all of these different things. The only thing I'm going to really be talking about today is organophosphates. We all know that OPs affect the nervous system of insects and humans, and we used to think that the only way was that OPs depress acetylcholinesterase, allowing acetylcholine to build up in the neuronal junction, and now we know that at least at low-level chronic exposure, we're probably dealing with lots of other mechanisms of effect. So even though we look at the relative toxicity of chemicals, which I'll get to in a little of OPs, looking at how much they depress acetylcholinesterase, we're probably really not understanding the full toxic effects of these chemicals. So about 500,000 pounds of OPs were used in the Salinas Valley during the years that our kids were in utero and around the time that they were born. We collected GPS coordinates on every child. At every single time that we interviewed them, we got their addresses, and even sometimes in between. You can see here the pesticide use reporting data, and you can see little dots, and those little dots represent the homes of where the women lived in during their pregnancies. So we're able to look at, using PUR data, the where women lived during their pregnancy relative to applications. Our main way of looking at OPs was to look at dialkyl phosphate metabolite levels, or DAPs. It's a imperfect but state-of-the-art prenatal biomarker of OP pesticide exposure. We took urine samples from the mother at 13 and 26 weeks gestation, and it's a metabolite, so it doesn't necessarily, we hope, but it doesn't necessarily reflect exposure to the parent compound, which is really what we want to get at. As I said, it's imperfect, and I'll go into its imperfection soon. We showed in, no pointer. There is a pointer? Okay. So we were able to, at the same time that we did our study, NHANES, National Health and Nutrition Examination Survey, was using the same lab, the CDC laboratory, to measure the DAPs in the general population of the U.S. at the same time. So we were able to compare what the levels looked like in CHAMACOS pregnant women relative to women of reproductive age in the general U.S. population. And as you can see here, CHAMACOS women had higher levels than the NHANES women. We also were able to look at the children, and these children's levels were done at 5 different times before the age of 5, but I'm only showing the age of 5 here. And you can see that the levels of the children are higher than the NHANES children at 6 to 11 years of age, and they're going up with each year that we measure them. So it has to do probably with metabolism and excretion of organophosphates. So we see higher levels of OP metabolites in the moms and in the children compared to the general U.S. population. So what have we found? We have found that moms' OP metabolites during pregnancy were associated with shortened gestation, abnormal neonatal reflexes, decreased mental development in toddlers, poorer verbal abilities in preschool, pervasive developmental disorder, and there's been a recent study out of the Charge, I think it was Charge, it was definitely out of UC Davis, I'm not sure if it was Charge or not, that actually confirmed that our finding that there was a relationship with autism. Now, pervasive developmental disorder is just more symptomatology, not necessarily clinical autism. We have also shown the relationship of these DAPs in pregnancy with attention deficit disorder. I would like to say that we do not see a relationship with neurodevelopment and child levels of exposure, only maternal in utero levels of exposure. And as an aside, John and I and our postdoc, Rachel, have found that in terms of respiratory disease and lung function, it's actually postnatal exposure that may be more important than prenatal. So for neurodevelopment, it's mostly prenatal that we're seeing so far. So one of the other findings that we found was that received a lot of press was that the OP metabolite levels in the mother were also related to the IQ of the child at age 7. And if you look here at mothers with high metabolite levels versus moms with low metabolite levels, you see about a 7-point IQ difference. That, just to put that into a frame of reference, the standard deviation is 15 IQ points. So we're talking about a half a standard deviation. And if you look at some modeling that had been done back in the 1980s by Bernie Weiss, you probably would then result in about a 50% increase in the number of children that will need special services just based on this finding alone. And it's been confirmed in other studies as well. The other thing, this is the same exact study, same exact result shown in a different way. This is the full-scale IQ over here, and these are 4 different domains that, as a composite, make up the full-scale IQ. And you can see working memory, processing speed, verbal comprehension, perceptual reasoning, and this is the no effect line, and you can see that everything is statistically significant. So the relationships that we're seeing are across the board. All domains of IQ are being associated with the early life exposure to OPs at age 7. More recent, sorry, I forgot about the slide. This is a slide from David Bellinger where he did an estimate based on our study and other studies of what IQ points are being lost by different exposures. And if you look at preterm births, we're losing on average a total number of full-scale IQ points lost in the general population of 26,000 children, about 34,000 IQ points. So that's preterm delivery. And to give you a frame of reference, organophosphates are about half of that. So about half as much can be. So we're talking about something that's pretty substantial if our findings are really pan out for the future, and given the imperfect exposure measures that we've got, these are pretty substantial effects or associations. This is just hot off the press. We've also looked at executive functioning, and these are children that are 9 and 12 years old. So this is more recent. It's very important, executive functioning, probably one of the most important in terms of adjustment in life. Is probably one of the most important domains because it has to do with risk-taking behavior and it has to do with planning behavior. And so if you see effects on executive functioning, you might also start being concerned about teenage pregnancy, violence, and just general things that we don't want to see happen in terms of sociologic effects. So here is a Wisconsin card sort test. It's an objective measure of executive functioning. It's computer-based. No one's making an opinion. It's just the child being tested. And we see significantly more errors with each 10-fold increase in maternal DAPs during pregnancy. We see significantly more errors in these children. And if you look at, this is a mother's report of executive functioning, and it should go in the opposite direction, just so you know. If they're to be concordant with each other, they go in the opposite direction because one's errors and one's how bad they are, so how good they are. And so if you look here, you see that boys, that's the blue, these blue and pink. Pink are the girls. I said this is right off the press. Blue is boys, pink is girls. That boys seem to be more, there seems to be a stronger association with maternal levels of OP exposure. So one thing that we're constantly looking at when we look at neurodevelopment, whether or not we're looking at endocrine disruptors or non-endocrine disruptors, is how boys and girls may react differently to exposure. So I said that DAPs was an imperfect measure of exposure, and now I'm going to tell you the imperfections. This is the shooting in my foot slide, now that I've just published so many papers using DAPs. First of all, it's very short term, and it's very variable. So what I'm exposed to yesterday, you might see in my urine today, but what I was exposed to last week, you probably don't see it in my urine today. So it's very variable. It is not pesticide specific. So if we look at my urine excretion of DAPs, you won't know if I was exposed to oxydimeton methyl or malathion, because oxydimeton methyl is so much more toxic than malathion. You won't know that by the excretion. It's therefore not toxicity weighted, so you don't know what went into that DAP level You don't know whether it's more or less toxic exposure. And it doesn't tell you anything about the source of exposure. It doesn't tell you whether it comes from food, whether it comes from environment, whether it comes from the parent compound, or whether it comes from being exposed to the metabolite, which is probably less toxic itself. So we decided to start looking at the pesticide use reporting data in a great deal of detail, and we really thank the EnviroScreen for all the work that you have done, which is, if you aren't familiar with it, everyone should take a look at it. That's my advertisement. But what we've done is we've begun to think about how to use the PUR data in more creative ways to look for us, more creative for us, not for EnviroScreen, to look at exposure to pesticides. And fortunately for us, California is very, very unique. The pesticides that are being used, the pounds that are applied, the application date, the location, and the crop treated are reported on the PUR data. And so given that we have GPS coordinates of everyone's homes, we can then map where they are during their pregnancies relative to where the exposure is occurring. And so that's exactly what we did. We took, I'm not going to go into this in detail, but we took each person's GPS coordinates, and then we looked at what sectors they intersected and how much exposure they would have gotten each sector, and we gave someone a weighted average of exposure, and then Bob Gugnier and our group also corrected it for wind direction, and we have a lot more to do on this, but I'm going to show you some preliminary results right now. So this is exactly the same slide that I showed you earlier. Unfortunately, full-scale IQ was on this side. But it's the same exact slide that I showed you earlier with everything, except that this is per standard deviation instead of per 10-fold increase in maternal DAPs. And the reason why we're doing that is because we now want to compare that to what happens when it's PUR data instead of maternal DAPs. And so this is exactly what we showed you. Everything should be below the line. That one is wrong, probably. This is now using OP exposure based on PUR data itself. And the one thing I want to add is that this is adjusted for the prenatal DAPs. So we've taken into account what the exposure, what the effects are here into this, okay? And what you see is an independent association of where you live relative to exposure. And what we think, although we're not sure, is that the urinary DAPs is primarily reflecting exposure via diet, whereas the PUR data is really relatively reflecting exposure ambient. And the two together make up a better measure of exposure to OPs than either one separately. So we said, okay, can we get at with PUR data what we can't get at with DAPs, which is let's look at the relative toxicity of what goes into the PUR data. I'm going to keep looking at Lauren and Melanie here, sorry. I'm looking for like, okay, can you give me some tidbits here? And so we've looked at the relative toxicity using just relative potency factor. And as you can see, oxydimethyl is much more, this is relative to this pesticide. And so oxydimethyl is much more toxic than malathion, as I pointed out earlier. So can you weight the amount of pesticides being used nearby a residence by the toxicity of that pesticide and then somehow put it all together? So first we looked at individual levels and how individual levels of each of these chemicals, okay? And this is, I hope nobody's on the webinar, but we don't see significant associations with chlorpyrifos or diazinon or malathion, but just like we expected, oxydimethyl, which is being withdrawn from the market right now, was the most significant. Now, this is a problem because, remember, all of these pesticides are being applied in the fields, So their applications are going to be very highly correlated. So it's really hard, and you can't put them all in the same model because they're so highly correlated unless we come up with a different way of doing it. I mean, we've done, for example, and I'll get to that in a second, a principal components analysis, for example. So you can see that oxydimeton methyl seems to be a driver here. And it falls exactly based on the relative potency factor, which is like a little scary, that you actually see those chemicals that have the most significant effect being the ones that are most significant in terms of relative potency. Okay, so there are many other pesticide groups that are being used, and we said, okay, how can we now lump together not just OPs and not just OPs and carbamates, because we know that they both, and we've done that too, they both affect acetylcholinesterase, but what if we now try to figure out a way to put in all the pesticides? And so first we looked at them in single groups, and again, the ones that seem to be the most related to IQ, and this is all with 7-year IQ, so we're just keeping the 7-year IQ here, is OPs, followed by the pyrethroids, and the fungicides, and the neonics are just borderline significant. And we have very little use of neonics. Please don't take a picture of this if you can. It's non-published. Again, you can't put them all in the same model because they're highly, highly correlated. So it's a problem. And so we said, can we combine these chemicals? So if you look at an individual square mile, you can say in that square mile there's been this amount of chemical, that amount of chemical, and different pesticides, and maybe you can come up with a rank order of how bad exposure you live near. And so we tried to do that too. And we used also a PCA. So this is exactly what I showed you on the last slide. And now that's a PCA trying to combine, this is a principal components analysis, trying to come up with a weighted way of combining statistically these different pesticides. It is not the most sophisticated way to do it, and we're trying to develop other ways of looking at multiple pesticide exposure. And you can see here the PCA is very similar to the relationship that we see with OPs. 5 minutes, okay. So as you can see, we need to consider the mixture of neurotoxic chemicals that children are exposed to. We've begun to throw into the mix DDT, PBDEs, and some of the other 100 chemicals that we've looked at, but it becomes increasingly more complicated. And also, you need pretty large sample sizes to do this right. But we're trying to find new and different methods. Neurobehavioral development is determined by many factors, and we've tried to look at all of these factors that are here. We've collected data on everything that's here. One of the most important things is genetics. And we're particularly interested in the PON1 gene because it's involved in the detoxification of organophosphates. We have shown that the relation of the amount of enzyme you have in your body is directly related to your genes, as shown here. But it's also related to your age, so that children who are older are more likely to have more enzyme to detoxify OPs. We have also shown that if you take that same exact finding that I showed you earlier, this is the same slide, and you take that full-scale IQ, and now you divide mothers up by how much enzyme they had to detoxify those organophosphates based on their genetics and their enzyme activity during pregnancy. And you say, if a mother had high enzyme activity, is her child going to be less affected, even with the same exposure, as someone with low enzyme activity? And so that's exactly what we looked at. We took that same exact result on full-scale IQ, and we divided mothers based on their enzyme activity, which is encoded by the PON1 gene, into low, medium, and high prenatal enzyme levels. And we looked at the relationship of DAPs and IQ in each of those three groups. Remember, I saw about a 6-point IQ difference with each 10-fold increase in maternal DAPs. If you were unfortunate and you had low levels of enzyme when you were pregnant, the average that we saw for each tenfold increase in your DAPs, about a 10-point decrease in child's IQ. If you had a moderate amount of enzyme, we saw about a 5-point decrease. But if you were fortunate to have a lot of enzyme, you were not affected. Your child was not affected. So here's a clear example of G by E, that we have to be looking at the genetics here. So one of the things that I'm leaving you with this, the lifetime exposure of environmental toxicants, what are we really concerned about? And this is what I'm really concerned about. I'm really concerned about what happens to the CHAMACOS kids when they become adults. We're seeing lots of things, like I said, executive functioning, attention, IQ. We know from other studies on child development that there are long-term sequelae of those particular endpoints. There have been very few studies that have actually looked at the long-term sequelae, and those studies have mostly been on lead, tobacco smoke, and air quality. There's been nothing on pesticides. I think, Bruce, you were involved in the lead one, some of them? Yeah. So let me tell you a little bit more about Salinas. Salinas is 75% Latino. It is mostly a third of the people live below the poverty level. It's got 2.5 times the homicides than the U.S. average, and 10% of the children of the high school students report being in gangs. That's report being in gangs. So we know it's going to be higher than that. We also know that Salinas is one of the 6 high-risk communities nationally for youth gang violence. So the question for me is, okay, how does all of these findings that we're seeing translate into long-term sequelae? We also know that these kids grew up with incredible adversity because of the kinds of low income and immigrant status and everything else. So what happens when you mix neurotoxic exposome with stress, and then you add to it the genes? Do we start looking at criminality? And that's what our long-term goal is to look at. I'm going to give you a preview into what we're seeing. You might call it a double jeopardy of looking at social adversity and pesticides, but given what we know about the genes and the adversity that's added to depending on what your genetic makeup is, I would call it a triple jeopardy. And now I'll show you the double jeopardy part of it. So we looked at adversity in many different ways: learning environment, income, you name it, home environment, stimulation. I can't even name all the things. That anything you think of in terms of adversity, we've gotten information on. And we said, what's the relationship of the 7-year IQ and DAPs in those women, in those children of those women that had high adversity versus low adversity? And what you see here is that the slope is much steeper for those with higher adversity, and that those with lower adversity were not statistically affected, even though it's still a decline. So what we haven't done yet is bring in the gene by social adversity, by pesticide interaction. That becomes way too complicated. We also found that the relationship of adversity interacts with OPs differently in boys and girls, so that different kinds of adversity affects boys more than girls. So here is boys in blue, girls in pink. High adversity, low adversity, high adversity, low adversity, and this is learning environment. So is the environment stimulating? And this is full-scale IQ. Boys that have a poor learning environment are most affected in terms of the relationship of DAPs and their IQ, whereas these boys are not. Girls are pretty much equally associated. One last thing. This is my last slide. Okay, I skipped one. And that is, we've also begun to look at the PUR data in relationship to the 10.5, and this is very directly involved with EnviroScreen. So we've looked at the pesticide exposure into quartiles. This is second, third, and fourth quartile, and this is full-scale IQ at 10.5 now, not at 7. We've added household poverty, and we added neighborhood poverty. And what we're seeing is that there is a relationship of pesticide exposure, poverty in the home, and poverty in the neighborhood, all impacting child IQ in an additive way. It's not multiplicative. So that a child who is living in a poor neighborhood, in a poor home, with with more adversity, and being exposed to pesticide is going to really be affected here, or there's going to be real strong associations. Just want to leave you with one last thing. There's change ahead. I don't have a more recent slide, but I'm always trying to say things are changing in California, and they're changing in that we've got more organic cropland, and we're radically decreasing the amount of pesticides that are being used. So that's the positive note here. This is OPs, and this is only 2011. If we were to follow it out, it keeps going down and down, and in Monterey County, where our study is, it's really gone way down. So I'd like to, at that point, thank you. Thank all the people on my team, and Kim Harley is next, so she's one of the people. And a special thanks to the families of Salinas.